This is your Houston chiropractor, Dr. Tristan Wendt, and this is...
I'm your Georgia chiropractor, Dr. Jason Dotson.
Dr. Dotson is here for a 3-day seminar training with Dr. Johnson and myself. He's learning how to provide a safe and effective ring dinger, biophysics adjustment, and the clinical history, the exams, everything that goes into a patient's visit here at the office in Houston.
It's been a wonderful 3 days.
Yeah. So Dr. Dotson's already learned the traditional ring dinger, the one that you see on almost every single video, but we've also got another option that we call the kinder, gentler version of the ring dinger, where it's more of just a traction stretch for the patient as they let go of a nice big inhale, exhale breathing pattern. And we get a lot of great movement on some patients that are a little bit apprehensive on getting that first big adjustment done with the ring dinger. So I'm gonna be taking Dr. Dotson, a little bit of a tongue twister there, through the kinder, gentler version here today. And he'll be providing me with one in a video after that too. You brought the whole family down with you too, right?
Absolutely.
Y'all been enjoying Houston? Good weather this week for it too. It was a little overcast.
Nice place to be.
Yeah, nice.
We love living and working here.
Yeah.
It's a great city.
So as you know, Dr. Dotson, these are going to be very tight here. I'll be scoot down a little bit more, about a 1/4 inch. Perfect. I told Dr. Dotson on his very first ring dinger that this is what we were going to do, and then I went into my own old neuro pathways and just went ahead and hit it. So we actually got great movement though on his first ring dinger, because you didn't think it was coming.
That did help.
There we go. So everything with this adjustment is the exact same. Set the table to where their legs are parallel to the floor, have both pins nice and snug on either side, and obviously the same towel position here. But for this adjustment, we always tell patients that as you're exhaling, that's when we're going to bring you into that really deep stretch there, and it's not going to be that impulse that you see on the videos. So big breath in for me, Dr. Dotson. And so as you exhale, slowly bring that spine into a nice big traction position. And as I feel that you're ready for that next big breath, I'll kind of let off. Let you take another big inhale. And the main thing I want you to feel during this position right here is that big stretch that I know you're getting all the way down your spine, probably about L2, L3 right there, huh? Pretty accurate on that?
Pretty good.
Go ahead and do the light thrust on him too.
So then after
that's
that-
really the kinder, gentler version. Is you're still doing a high velocity, low amplitude thrust. It's just not all full weight.
So big breath in for me. Continue to stretch, stretch, stretch. A small impulse. Again, not nearly as much of that force that you see on the traditional ring dinger.
Probably not as deep as the one I did.
Oh, I still felt it all the way down.
Yeah, good.
I've had all that scar
That's the whole
tissue
key.
broken up.
That's the whole key of it, though.
Absolutely.
Is for new patients sometimes that are apprehensive because they think this looks dangerous, you know, and it is a more aggressive looking adjustment. However, it's probably the safest adjustment in chiropractic, and that's from me doing it for 44 years now. And not ever having one person ever legs even been injured.
And the sensation that you get is a lot more controlled than what it looks like on a video.
Yeah.
You know, I give the analogy sometimes of almost just like a zipper sensation.
Right.
It's a type sensation all the way down your spine, and that's all the facet joints and discs being decompressed from
But the reason the first one is so dramatic too is
Yeah.
the patient has a lifetime of gravitational weight-bearing compression stress on the spine already. Their soft tissues have started adapting to that, and they get adhesions and scar tissue built up in and around the motor unit. So the first one, when you're breaking that up, is more dramatic to the patient too. Just because, you know, that's a sensation they've never felt in their entire lives.
That's right.
So it's dramatic.
So Dr. Jason's in here doing a comprehensive seminar with Dr. Johnson and myself, learning all aspects of what we do here in Houston at Advanced Chiropractic Relief. So how can patients get a hold of you, Dr. Dotson?
So you can call us at Dotson Chiropractic, and that's at 706-259-5599. And it's been great to be here.
What's your
and I'm
website?
honored. Oh, yes, thank you. DotsonChiropractic.com. That's DOTSON, chiropractic.com.
Sir. Well, Dr. Dotson's going to be trading out here with me because it's time for my first ring dinger for the day. So this is your Houston chiropractor, Dr. Tristan Wendt, coming to you along with,
Your Georgia chiropractic, Dr. Jason Dotson.
and we'll see you guys soon.